This next slide now builds on from group learning and has a look at sharing and trust. And sharing and trust, again, I was quite surprised that it was a finding that came, or a category at least of findings that came up over and over again. And it's very interesting. Students do share. They share in their PBL groups, in other words, their pre-organized group, and they share outside of those pre-organized groups in groups that they've shared, and they be they communicating on WhatsApp or sharing face-to-face, they share in those groups as well. What do they share? They share lecture notes, they share lecture slides, they share past questions, and they share their personal notes. And to a lesser extent, interestingly, their personal notes, because they view that as something that's taken them time and effort to create, and that almost gives it a higher value than something they receive from someone else. Trust is important, and it's important from both the sharer and the sharee's perspective. The person sharing information, they want trust in terms of the perception of their level of knowledge. They don't want to be judged, and they don't want to be taken for granted. And interestingly, they want security that whatever they've shared with a particular person is not going to be shared further without their permission. So they want the choice of what to share, when to share it, and with whom to share it. Anonymity is an interesting one, and from a sharer's perspective, it's important. But moving on to the sharee's perspective, the sharee, in fact, doesn't want anonymity because they want to know where that information is coming from. Because curation is important for the sharee, understanding whether that information is correct or unnecessary. It needs to be legible and coherent, in the words of one student. So students want to know the source. Trust in a lecturer is implicit, but trust from a peer is earned. And that trust is earned through assessment performance, how well the student does in the assessment, but interestingly, how active and how much they participate in the group learning activities. If a student's active, demonstrates their knowledge in a group learning environment, then they are trusted to be able to provide curated material. So competitiveness and a competitive learning environment, as is the case with medical students, is absolutely a barrier to sharing. Some students believe that the students that came top of the class were less likely to share than the ones that came further down the class, and it's definitely a barrier to sharing.